Are you experiencing pain in your big toe? Or perhaps you've been told that you have a bunion? Well, we're going to talk today about what a bunion actually is and what you could do about it. So my name is Dr. Arianne. I am a functional medicine practitioner, doctor of physical therapy, registered dietitian, owner of the Movement Paradigm Integrative Health Center, and we specialize in barefoot science and movement from the ground up. So I'm super excited to talk to you about bunions today. When someone has a bunion, it may appear as though there's this bony growth on the side of the foot because it's very prominent and it might stick out. There could be a small bunion, there could be a large bunion. So ultimately, it is not an overgrowth of bone. However, it is a loss of stability of the cuneiform joint. So this is the metatarsal, the first metatarsal. This is the cuneiform. So this is the cuneiform joint. When we lose stability in this joint, what happens is now this is considered our first ray. This is actually going to come out, right? Because we've lost stability in this joint. So now this comes out and then the body is going to adapt and create this valgus position in the toe. And so what we're seeing is this visual bump, but really it's actually the metatarsal that's creating that, right? Because it's moving all the way out here. And so with a bunion, we want to recognize that it is a structural complication and that you are truly losing stability in a joint. So it's important to recognize that the only true thing that is going to fix a bunion is actually surgery. But there are so many things that you could do to improve the stability and the function of your foot. If you've watched our channel enough, you know that we're always asking why. So why do we lose stability in the foot is a really good question. And this could be multifactorial. But what we want to think about is that our foot is going to spiral. So as we make contact with the ground, we are going to heel strike. This is what we call more of a locked, inverted, rigid position. Then when we go to mid stance and we're stepping, we're going to the foot becomes a little bit more mobile, okay, or unstable. So then we can get to this neutral position in our foot. Then when we push off, it needs to be locked, rigid, stable again. So there's this spiraling that's happening each step that we take. Think of in our walking, in our running, every dynamic activity, we're constantly having this spiral. Well, when we lose the spiraling mechanism, and that could be from various things. For example, if we lose ankle mobility, let's say, for example, we have an ankle sprain. So the ankle is going to have the natural inflammatory response. We're going to have pain, we're going to have swelling, we're going to have stiffness, but then fast forward 6 months or a year and it's still stiff. So now the body says, okay, so now my ankle is stiff. Where am I going to get that motion from? So what happens often is now the foot becomes a little bit more unstable. Okay, so now the foot starts to collapse a little bit. Okay, so this is the inside of the foot. So it starts to collapse here when we say we have a flat arch, for example. Okay, so your body says, okay, well, I'll get it. I could also get that motion from my knee. Let's say my knee caves in when I squat. So this is just one example, but to give you an appreciation for it is that when we start to lose the spiraling that could happen from our hip, our knee, our foot, etc., then ultimately that is what can contribute to this loss of stability in this first ray or this metatarsal cuneiform joint. So when we are stabilizing, when we strike the ground, we ultimately have to have this reflexive stability. So we need to be able to stabilize actually before our foot even hits the ground. It has to be fast, fast, fast. If it's not, if it's delayed, then we start to have all of these compensations up the chain. So ultimately, one of the things that we really need to work on when we're thinking about foot control is this reflexive stability that happens in our foot, in our hip, in our core, in our pelvis, and that can really help to make our movement patterns more efficient, help us transfer force better, and help us prevent bunions, but also help us to treat bunions. Okay, so now that you feel a little bit more comfortable with what a bunion is, I think that's really critical because when you look on social media and you see all these different things that are going to cure bunions, you really have to understand that it becomes a structural problem. And the structural problem is that you've lost stability in the joint. Okay, super, super important. So, this is going to depend on what do you do when you have your bunion. Is the bunion painful? Is it contributing to a lot of changes and compensations up the chain? These are the questions you want to be asking yourself, or of course, reach out to a qualified health professional to help you with these decisions and questions. But if you have a significant bunion, and so the metatarsal is really swinging out, and it's also causing pain in the joint, right? Because now the joint approximation is not going to be a smooth surface. Now it's going to be most likely jamming in the joint. So it can cause arthritic symptoms. It can cause increased pain and swelling. So that's something to consider. It's also going to affect your entire core. So when we think of what's called the deep front fascial line, that's our fascial line that's part of our deep core system. That is going to be significantly affected because, again, there's this loss of stability here. So it affects that entire line. So there's all these things we want to consider about how is it influencing you. If you have a really small bunion, there's a lot of things you can do, but if it's really severe, it might be causing a lot of other issues. So now let's dive into what can you do about it. Okay, so the first thing that I always suggest is a bunion spacer. So when we're using a bunion spacer, the goal of it, again, isn't to fix the bunion, but it is going to be able to put in between this first and second metatarsal to be able to maintain the space so that you can really assist in the proper joint positioning. That's really important. It's also going to help you to stabilize your foot better. So I definitely suggest this working in very slowly. It depends again on the severity of your bunion and if you're able to tolerate this. But something like Naboso splays are perfect because they can go in between all of the toes to help you create the appropriate amount of stability in the forefoot when you are walking. Also creates the appropriate amount of splay. So you need 3 millimeters of splay for women and 5 for men when you are pushing off in your gait cycle. So if you can wear this, especially during exercise, especially during walking or something where you're going to be on your feet, you can also consider it just for simple recovery, but I would suggest using it more for function. So working into a tolerance that you can maybe maintain them even wearing them all day. Okay. The second thing that we want to think about is actually strengthening the foot. So you can do that through a technique called short foot. So this is called the bowler exercise. Essentially what we're doing here is you're keeping a neutral foot, which means rolling the foot to the inside, rolling the foot to the outside, finding the position in between the two. From here, I'm going to inhale as I reach back, and then as I pull my leg back to the start position, I'm going to exhale and root the big toe specifically into the ground. Think of the tip of the big toe. So here we're trying to really essentially lift the bone in the foot called the navicular and essentially lift the arch of the foot. So we're creating that really good stability. So once again, you're in this position, you're in a hinged position. Inhale as you reach back. Exhale, root the toes and come back. This is really going to emphasize the spiraling pattern that I was talking about. And it's going to also build the stability and control and tension of the foot, which is why we gain a bunion in the first place. We want to begin to really build that tension and stability. The next thing we can do is a foot release. So this is a 6-point foot release where you are going to use, again, something like a Naboso ball, which has a sensory stimulation technology that can stimulate the small nerves in the bottom of the feet. This can be extremely valuable as part of a recovery technique. You can also do this first thing in the morning. So you're essentially going on 6 different points of the foot and you're holding that for maybe 20 to 30 seconds, allowing the tissue to relax. And again, can be really, really helpful to stimulate these small nerves and also influence your overall stability and connection to the ground. So these are just a few simple things that you can do to address your bunions, but please make sure to get thoroughly evaluated. You understand why you had the bunion in the first place, how the bunion is affecting you and your movement. Because again, this becomes a structural issue that can create compensations throughout the entire kinetic chain or whole body. So we really want to understand it at a deep level. So I do highly recommend that. But in the meantime, here are some simple strategies that you can integrate into your day-to-day life to help you feel better. And if this was helpful, of course, give it a like, give it a share, and subscribe to our YouTube channel for weekly tips on whole body wellness to really help you get to the root of your health issues, whether that be a movement or pain issue, or you're just seeking whole body wellness. And don't forget to check out our app, so the Movement Paradigm app on Apple or Google, and we have whole body health accessible to all. So please reach out if you want an individual session. You can check us out on our website. But thank you as always for your support. It's so great to have you. Bye.